Good morning, everyone. My name's Carla Macias, host of Austin's own medical show, Best Docs Network, featuring Forest Park Medical Center. We've got a great show for you today, and in the next 30 minutes, we'll be featuring doctor-patient stories from different specialties such as urology, family medicine, and pediatrics. Let's start off today's show with Austin urologist, Dr. David Cuellar.
Initially, I had a elevated PSA, and my doctor then recommended I see a urologist. And I went to the urologist, and because of the PSA, which jumped up all of a sudden, he said, we better check it out. And so then they did the check and ran the biopsies and said, no, you got cancer of the prostate.
Wayne was referred to me for an elevated PSA, which is a blood test that we use to detect prostate cancer early. After he had his biopsies performed, we discovered that he did have early stage prostate cancer.
I spent a lot of time with a urologist trying to decide which solution was the best, and discussed the radiation, the pills, and then talked about removal of the prostate as the options. So in working with the urologist, after much discussion, we decided the best thing to do was to have the prostate gland removed.
And of the surgical options, he elected the most common procedure that's performed today for prostate cancer, which is a robotic radical prostatectomy.
Most of the discussion was talking about the impacts of the operation. Dr. Cuellar is very patient in answering all of my questions. He gave a feeling that he was interested in your health and in making sure you understood all of the implications of the robotic surgery and the comparison. And so I was very comfortable going to him to do the surgery after visiting with him.
He recovered quickly. He went home in a day from the hospital. He regained his urinary control and his sexual function within weeks to months, and has kind of gone back to his normal routine. One
of the reasons I wanted to go with robotics was because of the quick recovery process. I lead an active life, and I needed to be able to feed cows and play golf and work with the grandkids. So the recovery was very fast. The incisions themselves were small, and I just don't even remember any pain at all associated with them. I was back carrying my 50-pound sacks of feed to feed the cows. Seemed like just the next week.
There are many advantages to robotic surgery. The key is to find a robotic surgeon who has great experience, as you would with any surgeon, whether it be open or robotic.
I would recommend that anybody would seriously consider going the robotic route.
Select art. wow, this is great, you know, and people are excited and they're lit up, and we get compliments, you know, the day we install it from the employees that are around, and, you know, it's a win for everybody. So, yeah, we all just keep moving forward.
Forest Park Medical Center is a different kind of hospital, designed for warmth, designed for comfort. Forest Park Medical Center is your destination to better health. Did you know eating oysters can keep your immune system strong? A 3-ounce serving has a quarter of your daily iron intake plus twice the zinc you need in a day. Orthopedics is the branch of surgery concerned with conditions involving the musculoskeletal system. Dr. Kelly Cunningham is an orthopedic surgeon here in the Austin area who uses both surgical and non-surgical methods to treat musculoskeletal trauma and sports injuries. Now let's meet the doctor.
I'm a sports medicine specialist who does orthopedic surgery. I started my training at UT and then UT Southwestern in Dallas. I've been in Austin for 25 years now and working with a group of other like-minded orthopedists, but my specialty has become cartilage injuries and the new emerging field of orthobiologics. I always try to offer my patients both surgical and non-surgical options. I am an orthopedic surgeon, and many of the injuries I see, ACL injuries of the knee, ski injuries, shoulder dislocations, rotator cuff tears, do require surgery, but many of the patients that I see also can benefit from therapy, from injections, and from non-surgical treatment. That's what led me into orthobiologics, because it offered some new alternatives for treatment of joint injuries without surgery. It helps heal cartilage in a natural way using the body's own healing processes.
Forest Park Medical Center is operated in 5 different cities here in the great state of Texas and will soon be serving the Austin and Round Rock community. Now up next, we're going to learn a little bit about Forest Park from the Austin CEO himself, John O'Neill.
Austin is very fortunate to have Forest Park come to this area. Forest Park is unique in that it's owned and operated by the physicians. So we're very fortunate to have a group of almost 100 physicians from the Austin area. I think they average about 15 years experience in Austin, every one of these physicians. So they know Austin, they know the people of Austin, and they know what Austin needs when it comes to healthcare. I think patients benefit greatly from a physician-owned hospital for many aspects. One is that who knows better than your physician what you need when you're in the hospital? And again, many physicians don't have that control or that voice in a typical hospital setting. But in this setting, they do have control, they do have a voice, and they will do what's best for their patients. I think it's the difference between owning a car and renting a car. When you're an owner, it's your place, and you want to make it special. You want to make it the best place for your patients to get care. And so I think that's really what makes it different. Our goal is to be the very best hospital in the community. Obviously, physicians know best what's good for their patients, and they wouldn't be so interested in this hospital and creating this hospital if there were a good alternative for them currently. So they're very excited. I'm very excited about working with them. It's going to be a very collaborative approach. I think there's a lot of uncertainty, obviously, in the healthcare industry right now and going forward. No one really knows what's going to happen. But to be successful, there has to be close collaboration between the physicians and the hospital. And what closer model can you have than having the physicians own the hospital and really control the hospital? So I think it's a successful model for the future and one that will greatly benefit this community. My example is the hotel industry. You could tell there's a difference between a 5-star hotel and a 2-star hotel. The people are happy to be there. People have just loved getting care there. You go to a 5-star hotel once and you want to go back to that hotel. That's the environment we want to create. You combine that with state-of-the-art equipment, state-of-the-art care, and that's going to be Forest Park Medical Center.
Rachel has a question for Dr. Cohn. What are the different ways to treat ear deformities?
There are essentially two ways to treat ear deformities. One of them is ear molding. This is reserved for patients if their deformity has been identified in the first 2 to 3 weeks of life. And then the other is an otoplasty, which is the surgical correction. And this is usually performed at 5 or 6, but it can be performed also into adulthood.
One of the things that is important in nursing or any type of career is making sure that everyone is well educated on what the expectation is of the facility. When I became the C.E.O. here at Forest Park, I wanted to be able to focus on clinical education to make sure that we were always providing safe care to our patients and that all of our clinical staff were able to be educated on doing the same thing every single time to make sure that there was no room for any type of errors to occur. With that thought, we developed an educational program and hired a clinical educator that is master's degree prepared to be able to provide that type of education to our staff.
My role as clinical educator here at Forest Park is just to make sure all clinical staff are up to date on all evidence-based practices and current literature, and making sure that we provide our patients with top-notch care that is contingent on what research is backing these days. I teach anything from American Heart Association classes to ventilator classes to classes on hemodynamics to classes on basic needle sticks, blood draws, anything in the healthcare arena.
Clinical education is very important to both of my areas because, as everybody knows, healthcare is always changing. We are updating our processes. We are finding new and better ways to take care of patients. And I want to ensure that my staff is doing everything they can to provide the best care they can to our patients. And so here at Forest Park, we have our clinical educator, Dan Cloud, who is very active with the staff, finding out what areas they feel like they need education on and finding out what is the newest research and articles that are out so that we can make sure that we're staying abreast of all of the newest research and practices.
Just seeing some of the nursing staff or clinical staff, when you're teaching them something, when it finally clicks or they can take it back to the bedside with them in their interaction with the patients, that is the most rewarding for my job. I can talk and tell somebody how to do stuff all day long, but if it doesn't get taken back to the bedside, then it's not doing any good, especially in a healthcare setting.
Best Docs Network, helping people find the right doctor at the right hospital. Best Docs Network, featuring Forest Park Medical Center.
So cholesterol, what's my goal? It used to be we look at the total cholesterol number and shoot for under 200. Well, it turns out that doesn't tell us enough information. So what we do now is subdivide the different types of cholesterol into LDL, HDL, VLDL. There's a lot of subtypes, but the big one to remember is your LDL cholesterol in particular. The goal used to be less than 130 across the entire population. And the more we study this, the more we think that lower is better. If you add in at least one cardiovascular risk factor, which would be, let's say, diabetes, now your threshold drops to 100. If you start adding in multiple comorbidities such as diabetes, high blood pressure, sedentary lifestyle, overweight, male sex, all these things are all risk factors. Now we start to push that LDL cholesterol even lower, with the goal being under 70. Overall, those are some good sort of ballpark numbers to talk to your doctor about. HDL cholesterol, the goal for that one is to keep it over 40 or 50 depending on what study you read. And the single best way to bring up your HDL cholesterol is exercise, the ugly word nobody likes to discuss. But it really does pay off for a number of reasons.
By heading over to bestdocsnetwork.com and clicking on Austin under the Our Doctors tab, there you will find all the different specialties a part of Forest Park Medical Center and Best Docs Network. One of those doctors you can find on our website is family physician Dr. James Hahn. Up next, Dr. Hahn will be discussing preventative exams with one of his patients. Let's take a look.
I try to come in for a preventative exam about once a year. just to make sure my cholesterol levels are where they need to be. We do have a family history of health issues, so I like to make sure that I'm well taken care of, and Dr. Hahn helps me out with that.
Zach is a patient that I've seen approximately about 3 years now. He's in his late 20s, and he's a very healthy young man, and he takes good care of himself in general. What's important in a patient like that is that he takes care of himself over time, and what kind of tests does he need, what does he need to do to stay healthy. And it's important for me to talk to him about what are the exams that he may need to be doing, but also important for me to tell him what are the important things that he needs to do to take care of himself in his everyday life, because obviously I can't know what exactly he's doing from day to day.
When I come in for a preventative exam with Dr. Hahn, he usually goes through all of your standard blood work. So he'll take blood samples and run all the tests on that. And then he'll go over just all my normal health procedures, check my blood pressure, check my weight, my height, everything that he needs to do to make sure that I'm in good health.
Normally for us, when we do the exam, we basically look from head to toe, just looking and listening to see if there's any abnormalities that we can detect. So, on a relatively healthy individual, we don't expect necessarily to find anything, but we will take a look. For example, listening to the heart sounds to make sure that this person does not have a murmur or an abnormal heart sound that may need to be investigated. After an exam like that, hopefully the doctor can say, hey, I know that you're in good health, but as you get older, these are the things that you might want to incorporate into your lifestyle. And I want you to do these examinations every couple of years so that I can take a look at you, look at all the data, and visit with you to see if you're doing all the right things to stay in good health.
My health's great. I cleared everything on the physical, and so I'm good to go for another year. Just keep in my routine, watch my exercise, watch what I eat, and I'll stay healthy.
The LEAP Foundation, we've been here since 1991, and we have operated more than 8,000 kids in more than 19 countries. Cleft lip and palate is our main operation, but we identify needs and we provide pediatric urology, we provide eye surgery, we provide ENT surgery, we take care of burn scar deformities. We really try and fill in the blanks of what is most needed in the particular country. We go on 6 to 8 trips a year. We routinely go to India, central India, the poorest, most remote part of India. We go to Zimbabwe and work in the children's hospital of that country. We go to Haiti multiple times a year because we started going there after the earthquake and developed deep relationships and just saw how many kids were in orphanages and had no access to surgical care. We go to Belize. We've been going to Belize for 18 years. We've been going to the Dominican Republic for 22 years. The most common procedure we do is cleft lip and palate because 1 of every 700 babies is born with this. The children don't have a chance for normal life if it's not fixed. If you do the surgery, then they have a chance for a perfectly normal life. I didn't start out in 1991 to build the LEAP Foundation. I went on a single mission trip, and it convicted me personally that there was such a need out there that I wanted to help as many people as I could. But the excitement from the other doctors and nurses who developed the same passion is what convinced me that no, this wasn't a single mission trip. We're going to go on another one, and then God filled in the blanks. We're here 22 years later. We've done more than 8,000 surgeries, and the opportunities to help people just keep growing. And we all do it because we're helping other people, but it also helps us too. It refreshes why we went into medicine in the first place. But we do it with a world-class quality. We don't do anything in another country that we can't do with world-class quality equal to what we can do here.
As a state-of-the-art medical facility, Forest Park Medical Center is unrivaled. So, naturally, it's where the finest physicians in North Texas want to work. And because of the extraordinary level of comfort and care provided to our patients, Forest Park Medical Center is where they prefer to come to. We're just happy we could bring them together. Come experience for yourself what medical care was meant to be. Forest Park Medical Center, your destination to better health.
I'm Carla Macias, host of Best Docs Network featuring Forest Park Medical Center. Today we are on site at our Austin location where we're going to take a look at the current development of the hospital. We are now standing in what will be the lobby here at Forest Park Medical Center. And I'm here with Rich Carlton. Now, Rich, tell us what your position is at Forest Park.
I'm the facility director, so I'm in charge of the facility, biomed, EVS, and security. I think we're at an exciting time where you're starting to see a bunch of concrete essentially transform into that place for healing that Forest Park wants to be. We're starting to see the renderings actually turn into a physical space as they unveil textures and finishes throughout the building. Right now we're on the grand staircase here in the lobby, which will take you up to our surgical suite. As you walk in, you'll see a large waterfall, which is an integral part of all the Forest Park lobbies. I think that the first thing you'll notice is how it doesn't have a hospital feel and how it has that 5-star hotel feel to it.
I think one of the first things you notice when you walk into this cafe is this beautiful mosaic. Now tell us a little bit more about it.
Well, I think first of all, one of the most interesting things is it wraps completely around the wall. It's 360 degrees, which there are a lot of different things to see in it. For example, you'll see the state seal of Texas. You'll see a longhorn. You'll see a bicycle, as you know, that bicycling is a very important part of the Austin culture. It really helps tie the facility into what makes Austin, Austin.
Now, Rich, tell us about the design concept here at the cafe.
One of the biggest things that you're going to notice, it has the feeling like you're in a fine restaurant dining room, not your typical hospital cafeteria.
We're now standing in one of the operating rooms here at Forest Park Medical Center, Austin. Now, Rich, tell us a little bit more about the operating rooms.
Well, I think one of the first things that stands out is the obvious size difference. It's much larger than your average operating room, and I think it allows us to bring in the newest and best technologies for the outcomes of our patients.
Just by walking in, I can already tell that this isn't going to be your average patient room. Tell us a little bit about it.
Well, I couldn't agree with you more. I think that this is probably one of the most unique aspects of the Forest Park model, and that is the VIP suites, which not only provide the healing space for the patient, but actually a separate room for their family to join them through their healing journey. Every patient room here at Forest Park Medical Center Austin have a green view, so you can take in nature as part of the healing process. You'll find that a lot of the connections and things that you usually see behind a hospital bed for medical use are hidden behind cabinets. The patient beds here at Forest Park are going to be quite different than what I think most people have experienced at other hospitals. We use 300-count sheets, bedspreads, we have throw pillows. It's just another way that we can make you feel at home during your stay at Forest Park. I think Forest Park is bringing a level of healthcare that hasn't been in the area. I think it's a whole new level, and I think it's exciting for both Austin and its soon-to-be patients.
So, Rich, tell us where we're standing right now.
You're at one of the more unique aspects of Forest Park Medical Center Austin, and that's our green roof, providing a green view for all of the patients on this side of the hospital. I think one of the benefits of our current location is that we're at the edge of Austin, so we're poised to easily serve the Austin community as well as the northern communities of Round Rock, Georgetown, Leander. Also, it's located next to 3 main highways, Mopac, 45 and 35, so it's easy to get to. I've been watching the project develop over several months, and getting to see the finishing touches and kind of the finished product take shape has been extremely exciting.
When should the Austin community expect doors to open here at Forest Park Medical Center?
Austin can expect Forest Park Medical Center to open in the summer of 2015.
Did you know that by heading over to bestdocsnetwork.com, you can request an appointment with any of the doctors you see on today's show? You can do this by conducting a search by specialty and on their profile page, clicking on the tab located at the bottom that says Request an Appointment. Now up next, we're going to hear from Pediatrician Dr. Ray Esparza.
Madeline has been seeing Dr. Esparza for 13 years. Her physical exams have been yearly unless she needed a sports physical. It's nothing that she's ever dreaded. Madeline loves going to see Dr. Esparza, and he makes them feel very comfortable and at ease and answers their questions.
My last physical exam was for when I was about to try out for my high school volleyball team. He did basic checks for bones and muscles and make sure nothing was torn or damaged. And he tested my spine because you kind of have to stretch a lot whenever you are in volleyball. You kind of have to monitor how much junk food you eat. I'm really healthy now because he has straightforward told me that you need to be a lot healthier if you're going to continue to be in sports and other physical activities. I work out now every day and I eat a lot healthier food, gluten-free, lactose-free. He makes sure that we can live healthier.
A physical exam is a preventative exam. We actually do quite a few things in a preventative visit. During your teenage years, the reason you want to get a physical exam is to make sure that everything is developing appropriately as well. Now, at that age, you can better judge blood pressure, you can judge vision, hearing. You want to make sure that if they're athletes, you assess their heart. You want to make sure that an athlete, when they go into the playing field, that they don't have a heart condition that can cause them to have trouble while participating in their sport.
Dr. Esparza is just great. He's wonderful. He makes the kids feel at ease when they're in there. He doesn't talk to them like children. He talks to them on an intelligent level, answers their questions in an intelligent manner. He's very honest with them, and I appreciate that. Doesn't lead them off in the wrong direction and tells them exactly what they need to do to have a healthy lifestyle.
Whenever you go into his office, they kind of make you feel like you're going into your other house. Thanks to the yearly checkups of Dr. Esparza, I feel better and I look better thanks to him.
Jennifer has a question for Dr. Kansas. Does estrogen cause breast cancer?
In the female, when we see them for hormone replacement therapy, a lot of their hormonal issues do have to do with estrogen. The bottom line answer is no, it will not increase your risk for breast cancer. If we have a female that starts estradiol, we do ask that they get an annual pap smear and a mammogram. If they have a history of estrogen receptor positive breast cancer, then we will avoid estradiol in those patients because it can elevate their risk of a recurrence.
Lodging provided by Radisson Hotel and Suites. Didn't find the right doctor you're looking for on today's episode? Head to our website, bestdocsnetwork.com. There you can browse through all the different specialties a part of this network. We love hearing from our viewers, so if you have any questions or comments, please feel free to email us at info@bestdocsnetwork.com. My name's Carla Macias, and thank you again for joining us on this week's episode of Best Docs Network featuring Forest Park Medical Center. So long.